Hi everyone, good evening and welcome to today's episode of Back to Basics. So today we are going to speak about one of the very rare conditions or rare topics where there is an injury to the spinal cord which happens, or there is a vascular involvement which causes a spinal cord involvement. Hi, my name is Vandana and I am a senior physiotherapist working in PRS Neurosciences. So when we are talking about vascular injuries in spinal cord, the word vascular itself means that there is a lot of blood vessels which come into picture. So this is one of the conditions where we see that the blood vessels are getting affected. Like any other organ, blood supply to the spinal cord is equally important. So when the blood supply itself gets cut to the spinal cord, it can cause a vascular injury, or it can cause something which is called as a stroke. So when you hear the word stroke, it is usually associated with that of the brain. But in this case, when you check if there is an injury or if there is a cut of the blood supply, which happens either by a non-traumatic case, like in case you can see that if there is any kind of increase in the blood pressure, or if there is atherosclerosis which can cause the ischemic, or there is no blood supply happening to the spinal cord, it can cause something which is an ischemic kind of spinal stroke, and something where it's a traumatic or there is a hemorrhagic kind of spinal stroke. In such cases, the spinal cord, which is provided by the anterior spinal artery and the posterior spinal artery and other bunch of feeder arteries which are present, all of them get affected. Majorly which area the injury is happening or the stroke is happening, majorly whichever area is affected, that same level, it exactly behaves like that of a spinal cord injury. So in case of a normal traumatic spinal cord injury, when we say that the area injured or the part injured is somewhere around level 5, L5 or lumbar 5. So similar to that, if there is any kind of stroke that has happened, or if there is any trauma which has caused a bleeding in the area of lumbar region 5th, this similar thing will be causing a spinal stroke in that case, and almost all the features will be pretty similar to that of a spinal cord injury, as you've seen in our previous episodes. So the symptoms of spinal stroke can appear within few hours as well. So when we are seeing at the symptoms of spinal stroke, it can start with something like a sudden neck or a back pain, or whichever area is affected, and it can also be manifested like if there is any weakness in the leg or weakness in the upper limbs according to the area which is getting affected. It can also be seen by the loss of bowel and bladder functions. So majority of the spinal cord injury symptoms which are seen, the spinal stroke also causes the similar symptoms which are seen. There is one of the major things which happens in spinal stroke, that is above the level of T8, that is the thoracic 8th number segment. What happens is, if there is a vascular stroke, or if there is a vascular injury which happens to the spinal cord, in such cases the blood supply itself gets cut. So usually the cells of that area starts dying off. So that results in a reduced spasticity. So usually in such cases we will not find patients who have an increased spasticity, which is usually one of the symptoms which is seen in spinal cord injury patients. But in vascular strokes, the spasticity which is there in the patients is less. So as we have spoken before regarding the ischemic or the hemorrhagic type of spinal strokes, what happens in the ischemic type is the blood supply which is going, it can be blocked because of any kind of small clots which is there. So that small clot can be formed because of any kind of atherosclerotic plaque also, or if there is any blood clot, it can form an emboli and move to the spinal cord blood supply, which can cause an ischemic spinal stroke. The hemorrhagic, on the other hand, can be caused because of any kind of trauma. Usually a trauma causes a hemorrhagic type of spinal stroke. In one of the rare conditions, what happens is there is something which is called as an arteriovenous malformation, where the blood vessels itself are entangled. So when they are tangled, there can be crossover of the blood which can happen, and that can cause a spinal stroke as well. Thank you for watching our videos, and for more such informative videos, please subscribe to our channel. Thank you.